Quflora Fe is a combination of vitamins, iron, and fluoride. It is used to treat or prevent deficiency in children due to poor diet or low levels of fluoride in drinking water and other sources. Vitamins and iron are important for the body and help keep you in good health. Fluoride is used to prevent dental cavities. It is recommended to take Quflora Fe as directed by a healthcare professional, usually once daily. It is best to take it at the same time each day to help you remember. If you have any questions about the best time to take Quflora Fe, consult your doctor. Remember to not take more than the recommended dosage and to store it at room temperature away from moisture and heat. Make sure to chew the Quflora Fe tablet thoroughly and swallow it as directed by your doctor, usually once daily after brushing your teeth. If your child is unable to chew and swallow the tablet safely, be sure to consult your doctor or pharmacist for advice. For the best results, it's recommended to take this medication on an empty stomach, either 1 hour before or 2 hours after a meal. However, if you experience stomach upset, you can take it with food. It's important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they can decrease its effectiveness. The fluoride in this chewable tablet is absorbed directly into the teeth during and after chewing, as well as into your body from the stomach. It's best to refrain from eating, drinking, or rinsing your mouth for 30 minutes after taking this product. To ensure you receive the maximum benefit from this medication, it's important to take it regularly at the same time each day. It's crucial not to exceed the prescribed dose. If you experience stomach upset, constipation, or nausea, it's important to let your doctor or pharmacist know. Iron in Quflora Fe may cause your stools to turn black, which is not harmful. If you notice any mottling or staining on your teeth, consult your dentist or doctor as this may be a result of too much fluoride. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. While serious allergic reactions are rare, seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. Remember to always consult your healthcare provider for medical advice about side effects. Accidental overdose of iron-containing products is one of the leading causes of fatal poisoning in children under 6 years of age. It is important to keep Quflora Fe out of reach of children at all times. If an overdose does occur, seek immediate medical assistance or contact a poison control center. Before taking Quflora Fe, it's important to talk to your doctor or pharmacist about any allergies you may have to its ingredients, as well as your medical history. This medication may contain aspartame, so if you have phenylketonuria, PKU, or need to limit aspartame in your diet, be sure to discuss this with your healthcare provider. It's also important to inform your doctor or dentist about all the products you use before having surgery. Quflora Fe is not typically used by adults and is unlikely to be used during pregnancy or breastfeeding. If you have any questions about using this product, consult your doctor for more information. Remember, it's essential to follow your healthcare provider's recommendations for the best results. Before taking Quflora Fe, it's important to be aware of potential drug interactions. This could change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Quflora Fe can interfere with your body's ability to absorb certain drugs, especially if you take them around the same time. These drugs include levodopa, quinolone antibiotics, such as ciprofloxacin, levofloxacin, tetracycline antibiotics, such as doxycycline, minocycline, thyroid medications, such as levothyroxine, and drugs for osteoporosis, bisphosphonates such as alendronate. Ask your doctor or pharmacist how long to wait between doses and when you should take your medications. If someone has taken too much Quflora Fe and has severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Do not share Quflora Fe with others. It is best to get your vitamins and minerals from food whenever possible. Maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. Check the fluoride content of your water supply by asking local town or city officials. Fluoride supplements are not necessary if the fluoride content in the water supply is greater than 0.6 parts per million. If your water supply changes, check with your doctor or dentist to determine if extra fluoride is still needed. If you forget to take a dose of Quflora Fe, take it as soon as you remember. If it's close to the time for your next dose, then just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It is important to store Quflora Fe at room temperature, away from heat and moisture. Make sure to keep it in a place that is not the bathroom, and always keep it out of reach of children and pets. When it is expired or no longer needed, be sure to properly discard the product according to the instructions provided by your pharmacist or local waste disposal company. Avoid flushing the medication down the toilet or pouring it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.